there's a man who likes to bet on storks, and he was asked a question about healthcare in a CNN town hall, and his answer was infuriating.
I have multiple sclerosis, and this disease is treated with very expensive pharmaceutical drugs. In addition to the ever-increasing costs of my generic drugs, the cost of the primary drug I take for the multiple sclerosis now retails one dose at $21,800. I get this every 6 weeks, $21,800 for a little bag of clear liquid that is infused in my chest. It has depleted our savings, and I worry about how we can afford the ever-increasing costs of these drugs that reduce the progression of my MS.
Diane, thank you for being here. And again, for having the courage of sharing your story so we all understand the consequences of the policies that we've adopted in this country. You should be able to get the care that you need to live your life to the fullest. And cost should not be an object or a concern or an anxiety of yours. I want you to focus on being well and doing well for others. To add insult to injury, you and I, as taxpayers, have funded so much of the research and development for the cures and the medications and the pharmaceuticals that are sold back to us at the highest prices on the planet. We prevent you from buying from Canada or from Europe or somewhere else where you can purchase it cheaper. And we refuse to use the purchasing power of Medicare, the leverage in all of the prescription medications that we buy for those beneficiaries, to drive the price down. We have a plan to address this. We're going to make sure that every single American has access to high-quality, universal health care without exception. There's a plan called Medicare for America. That will ensure that everyone who does not have care today is enrolled in Medicare. Those who have insufficient care, they can't make the copay after insurance kicks in or afford the premium or bridge the deductible, they can choose Medicare as well. But those who have employer-sponsored insurance and like it because it works for them and their families are able to keep it. And we use the leverage of this government, not just for Medicare, but Medicaid beneficiaries, VA beneficiaries, TRICARE beneficiaries, to bring the prices of these medications down so that you and other Americans can afford them. That's what we should be able to do. Thank you, Diane, for asking the question. Appreciate it. Yep.
So you mentioned your plan, or the plan that you signed on to, Medicare for America. Why not Medicare for all?
I think about Diane. I think about Joey, a young man, 27 years old, that I met in Laredo, Texas. He's been to a doctor once in his life because he does not have insurance. And that doctor told him that he had diabetes, that he had glaucoma, and that he would be dead before the age of 40 because he's not getting any care right now in this country. Joey, Diane, others, they don't have time for us to get to the perfect solution. If we were to start from scratch, maybe we would start with a single payer, but we've got to work with the system that we have here today. The surest, quickest way to get there is Medicare for America. It guarantees every single person in this country gets the care that they need to live to their full potential and do those things that they were placed on this planet to perform in the first place. So that's why I support that plan.
At this point, the centrist corporatists know we can't win the debate on this issue. It's over 70% of the American people, including a majority of Republicans, they're in favor of Medicare for all. So since they can't beat it, what they're trying to do is be weaselly and conniving and clever and confuse you and make you think they support it by naming their plans like Medicare for America, Medicare Extra, Medicare for All Extra. They come up with these goofy-ass names in the hopes that people are confused enough to go, I don't know, I guess that's the thing, right? Isn't that it? Is that the thing where everybody's covered full stop? And the answer is no, that's not it. But they're not being honest and upfront about the fact that they don't support it. They're being weaselly and trying to leech off the popularity of Medicare for all while not delivering on that promise and on the real solution. And just understand, everybody who's not in favor of Medicare for all, what they're saying is, hey, there are 10 leeches on your back. I promise I'm going to take off 5. But I still have 5 leeches on my back. You should probably take them all off. We're going to do a little half measure here, and I'm going to take off 5. Hey, it's better than nothing, right? I mean, it is literally better than nothing, right? So why are you complaining? We're complaining because you're not fundamentally questioning the premises of the system. We have a system where there's an unnecessary, rapacious, for-profit, mafia-like middleman that gets in between you and your doctor and quite literally has death panels. There's a process called rescission where they try to cancel contracts based on saying, oh, you didn't disclose you had X, Y, and Z, therefore that was a pre-existing condition, therefore we're not going to cover for your fucking cancer treatment or whatever it may be. You're saying, let's not shake stuff up too much. We don't want to rock the boat here too much. But the most infuriating part is, as you're saying that, you're also trying to pretend like your plan is just as good, if not better, than Medicare for all, and it's simply not. So there's a lot of that I was like really pissed about. Here you have a woman stepping up and being very vulnerable and explaining her situation, and Beto goes right back to his like standard politician shtick. And that really creeps me out because you want to talk about if there was ever a moment to have like a genuine response, but he doesn't. He goes right back to the pre-planned script. So for those of you who don't know about this stuff, behind the scenes, his staffers tell him like, oh, whenever anybody asks a question, you have to thank them and act like you're really appreciative of all these things. And so he says, well, I want to thank you for being here. And he goes right back into with his fucking perfect posture and the way he points, he does the politician point. And he goes right back into his, like, pre-planned stump speech. And it's like, bro, are you not human? Are you a fucking robot? You just heard somebody pour their heart out about how they're massively suffering and they're basically going bankrupt from having to pay for medication. And you go right into, well, thank you for asking that question. What the fuck is that shit? Thank you for asking that. Can you just fucking say what the actual goddamn solution is? I think we should have a system like the UK where you go and you pick up drugs from the pharmacy and you only pay $10, full stop, and the rest of it is covered by the taxpayers. That's it. That's it. But he doesn't say that. You want to know why? He doesn't fucking believe that. That's why. Then he does the Obama move. Oh, you can keep your insurance if you like it. In the US, we pay double for our healthcare and get worse health outcomes than other developed nations. So your argument is, yeah, but if you like paying double and getting worse health outcomes, sure, you can keep it. Employer-sponsored health insurance is a goddamn scam. It's a scam because people know, oh my God, I can't, like, change jobs because then I'm going to have to worry about that 4-week gap where I don't have coverage and I need coverage because I got to get my medication. So people literally take jobs they don't want so they can get the health insurance. If you like people don't like their health insurance, Beto. They like their doctor. It's not like anybody's ever sat around like, oh, heaven forbid I ever leave the wonderful Aetna. Wonderful. I love it when they jack up the prices and make me poor. He's a technocratic, wonky, tweak around the edge, neoliberal corporatist goon. That's what he is. And this is not what we need. That was Bill Clinton, that was Barack Obama. We've had the technocratic, centrist corporatists, and all they do is embolden Republicans because the half measures are not loved. The half measures are not loved, and then the right beats up on them anyway and accuses those half measures of being socialism. So you get the double whammy of the proposals not being all that popular, and then the Republicans pretending like they're the populist solution to this shit. And they go right back to the same goddamn playbook. Oh, yeah, if you like your health insurance, you can keep it. Oh. And then the worst line of all is, he says, well, these people can't afford to wait for the perfect solution. No, they can't afford to wait for the half measure. How did he use that argument? They can't afford to wait for the actual solution. No, they can't afford to wait for the fucking shitty half measure that still keeps the root of the problem in place, which is the greedy, rapacious, for-profit health insurance mafia middlemen. Oh, God damn it, man. Listen, this is one of those issues where there is no compromise. I'm sorry. You want to accuse me of having a litmus test? Guilty. I have a litmus test. If you're not for Medicare for all, and you're running as a Democrat in 2020, you're beyond hopeless. It's not like you don't get to pretend like, who knows, bro? You know, you say tomato, I say tomato. You say you want to put the actual solution in place. I say I want to do another goofy-ass middle ground approach, which is going to get shit on and destroyed by the Republicans anyway. Hey, man, I guess it's all equal, right? I guess it's a wash. No, it's not a wash. Your plan sucks ass, and Medicare for all is correct. That's what we're looking at here. And even in a situation where somebody is explaining in very clear terms, here's how broken the system is, and what are you going to do about it? You still don't give the proper answer. You do your heartless, robotic nonsense. By the way, for a rare instance of the CNN host nailing it and saying, why not Medicare for all? And what's his response? The classic politician dodge. Classic politician dodge. I know a guy named Steve who had this, and this problem. I know a guy named Dave who has that, and that problem. And notice, does that answer the question? No, it didn't answer the question, did it? You're pivoting to the anecdotal to pretend like you care. Oh, my heart bleeds for this person I met. Oh, they have such terrible problems. Yes. Then why aren't you in favor of the solution, Medicare for all? That's the only solution. Why aren't you in favor of that? Well, I'm just going to give you gruesome details of somebody who's suffering in the hopes that you think I care deeply for them, so my solution must be good, because that's why I'm bringing them up. No, it's the classic bullshit politician dodge, where you make it personal. Oh, I'm going to talk about a person I met. Whereas, again, that ignores policy. That dodges the substance. I'm telling you, man, it's a different era. It really is. We're not in the old school era anymore. I think now people are much more likely to hear that shitty dodge of like, I'm going to tell you about a person I know, and they're going to go, wait, that's not answering the question. Because a Republican could do that too. Why don't you care? Why don't you want to do, this solution to a problem? Well, I met a guy named Tony, and I met a woman named Jennifer, and let me tell you about Tony and Jennifer. Why? Why are we talking about Tony and Jennifer? Let's talk about the fucking thing I fucking asked you about. He's an incredibly sleazy politician. And everything he's doing is an attempt to get elected. That's it. He cares about the narcissism and the self-aggrandizement of being president. And he's overly coached. Everything is fucking laid out in advance. Him and his staffers try to plot their way through this fucking thing. There's not a genuine moment since he's been on the campaign trail, and that's continuing to be the case. And he's not what this country needs at this point.